So the posterior hip capsule release is really helpful for those of you who have limited hip flexion, for those of you who have a little bit of a wonky hip hinge, and sometimes also for those of you who get a little bit of pinching in the front of the hip joints when you're doing your lunges or your squats. This may be a good go-to drill for you. Now our focus here is mostly to get into the capsule itself with the hip, and ultimately because the capsule is so rife with joint mechanoreceptors, if we're able to get the connective tissue neurologically in the hip capsule to release, the associated muscles should also release as well. Because the hip capsule is deep to a lot of musculature here, predominantly big muscles like your glutes and the hip rotators, we want to try to set up in a position where we're able to first put those muscles like the glutes and the hip rotators in a slack position. So I would recommend starting with the leg straight, maybe laying down. If you want to then play with opening up the hip joint as far as more internal rotation or more external rotation to get the ball to interact with the capsule differently, you're welcome to do that. You both mostly want to focus on first going along the edge of your sacrum just to try to work through the connective tissue of the SI joint and the sacrotuberous ligament. And then from there, I like to go along the top of the iliac crest, just kind of along the line of the glute medius, and then just kind of scouring the rest of the hip, trying to find those nasty adhesive spots that are sensitive, spending some time with the ball putting pressure on those areas, breathing through it, and turning the hip into different ranges to try to get the ball to release it effectively.